Hello, my name is Dr. Priyanka Saokar. My clinic, Deccan Dental Clinic, is located in Pune on FC Road. So today I am making this video. This is a part 2 about the orofacial pain, where I am going to discuss how to diagnose the orofacial pain and how to treat it. So for the diagnosis of orofacial pain, first thing comes is the localization of pain. We have to localize where exactly the pain is occurring, whether it is intracranial, extracranial, or it is inside the mouth. So first is a diagnosis. For diagnostic purpose, we might advise patient few x-rays that might include OPG, that is the x-ray of all your teeth, then the lateral cephalogram, that is the x-ray of your skull. In few cases we have to advise patient CBCT also. If the it is a complex case of trauma, then we advise CBCT. Once we get the x-rays, that time we can clearly rule out whether there is any dental issue or any skeletal issue, or if it is related to soft tissue, we have to examine clinically very well. So as I told you, first we are checking patient thoroughly. Clinical examination we are doing, where we are trying to localize the pain. Along with that, we are asking some basic investigation like x-rays or CBCT. Third thing, we ask patient detailed clinical history as well as dental history, whether patient has undergone any dental treatment recently, or any clinical history, whether they have undergone some medical history like operations or something. So we have to ask medical history in detail. The recent blood reports, if patient has done any, just to rule out whether there is any systemic reason for that, or even the patient has history of migraine, just to rule out. Then the fifth, we ask patient about the exacerbating factor for such type of pain, because of that, like a trigger factors because of which the pain occurs, like exposure to cold or exposure to cold food stuff. Whatever the reason or trigger factor, we have to note down that. Along with the dental and medical history, as I told you, we take all the previous records of patient just to rule out what exactly the causes behind it. And once we get the x-rays and CBCT, in that also we get the details. Once everything is done, we ask about the duration of pain, like how long it lasts, type of pain, whether it is pinpoint pain or dull pain or throbbing pain. So type of pain, duration of pain we ask, and at which time it is occurring, early morning or the late night. Mostly the early morning when pain occurs. Regarding to muscles, it is related to night grinding habit. All such small points we rule out. And then comes, this is the diagnosis part for the orofacial pain. Then comes the treatment planning. Now how to treat the orofacial pain? First thing, for the treatment, whatever factors we have noted down in a diagnosis, according to that we make a flow chart. Why the pain is occurring, what is the cause behind it. First thing will be to treat that cause. If it is a dental related pain, we need to treat that cause. Like if the pulpitis is there or decayed teeth is there, then we need to do filling. If the pulpitis is there, like deep decay, then we need to do for RCT. If it is related some wisdom tooth, then we need to do disimpaction of tooth. If it is related to old RC treated tooth where the infection is there after the RCT, we have to do re-RCT. So dental pain, all such treatment we do. If it is a vascular pain related to the history of extraction or the history of injury, then we have to advise some painkillers, anti-inflammatory drugs to the patient just to reduce that pain. If it is musculoskeletal pain, muscles are paining, then we have to give some muscle relaxant along with the painkiller, so that that pain subsides. If the patient has night grinding habit and because of that pain is occurring, we have to give the night guard, so that patient is able to stop that habit, at least reduce that severe stretching of muscle. So night guard is needed for the patient with the bruxism. If the patient is having intracranial pain, then we have to refer them to medical department. Again, if it is neural related pain, we have to refer them for the neural pain to the medical department. If it is related to migraine, again we have to refer them some MD doctor who can deal with the migraine. So likewise, first we have to diagnose the problem properly, and then we have to refer to the patient according to, like suppose ear, nose, throat is causing pain, then we have to refer that patient to ENT, just to rule out the cause of pain and just to treat that pain properly. So this is all about the diagnosis part and the treatment part of the orofacial pain. So hope this video must have cleared your doubt. Do like my channel guys. Bye bye, take care.